So the MODY is characterized by three features: mild hyperglycemia or overt diabetes in at least 3 consecutive generations. So we saw about family history. Onset usually above the age of 25 years, but we might be not diagnosing them, but onset is before 25 years. Absence of islet antibodies and lack of characteristics of type 2 diabetes. So the insulin resistance or obesity will be absent in our patients. So if you see our patients, she was having a mild hyperglycemia or overt diabetes. Yes. Was there a family history? We saw the family chart. Yes. Onset usually before the age of 25 years. She is 19. Absence of islet antibodies. We saw 2 antibodies. The patient didn't have any antibodies. Lack of characteristics of type 2 diabetes. So she is very thin. She didn't have any acanthosis. She didn't have any viral wart, or she didn't have a belly, or she didn't have other features of insulin resistance. So the MODY is characterized by these 3 features. Genetic testing is very important to characterize whether the patient has got MODY or not. So once we have looked into all those phenotypic features, always see whether the patient, are we suspecting MODY or not, which can be by autoantibody negative status and C-peptide. So once it helps us to narrow down what is happening, then genetic testing is the pathognomic feature where it tells what type of MODY. So there are various types of MODY available. We'll see it in a while. So genetic testing helps us to know what is the type of MODY that is present in our patient. So genetic test helps in detection and diagnosis of MODY. It not only helps in the detection diagnosis, what is the mutation that is causing the disease can be excluded without any doubt whether the patient is having MODY or not. Once the mutation is successfully detected, it also helps in identifying other first degree relatives also who are more likely to have MODY, with each full sibling contains a 50% chance of inheriting the same mutation in most cases. So we can see in the other family members also. And predictive testing, as opposed to the diagnostic testing, is a test in which the asymptomatic family members can undergo for early diagnosis of the disease. So it can be like with a predictive testing, like the asymptomatic family members also can be seen. So these are the various types of, these are not the only various types. There are, as I said, there are about 70 types of MODYs are available. But the most 3 common types of MODY that we see are HNF1 alpha, HNF4 alpha and glucokinase. So these are the commonest type of MODY which are present. So the common MODY are HNF1 alpha and glucokinase are the most common. HNF4 alpha constitutes about a minimal thing. The rest all MODYs are very rare. So this is what we need to know. So when we talk about the various types of MODY, we will discuss about briefly about these 3 types of MODY, which is very important. So the first MODY, MODY 1 is HNF4 alpha.